All right, so this is Operative Dentistry review series number 2. All right, if you have not reviewed number 1, so go back and review number 1. All right, so that you can benefit from the practice. Okay, so this is going to be a total of 10 review series. All right, to practice operative dentistry for national board preparation. All right. And if you need those lectures, please email me so I can send you those lectures for those of you who are taking my courses. Okay? All right. So let's proceed. So, question 11 of 100. According to Schillingberg, the ideal margin design, the finish line for a full cast guard crown is what? Okay? A. Chamfer. B. Shorter. C. Shorter with bevel. Or D, or the above. Okay, so remember the finish line for a full cast guard crown preparation should be a chamfer. Okay, so our answer here is what? A, right? All right, number 2, or question number 12, okay, of the series regarding non-vital tooth bleaching. So you have to know about tooth bleaching. Don't go in this exam without knowing about tooth bleaching, because a lot of people are doing tooth whitenings in their offices, and most likely you are also going to be doing tooth whitening in your office. So make sure you know the procedure for tooth bleaching. Okay. So regarding, excuse the spelling here, regarding the non-vital tooth bleaching, which of the following is correct? Okay. A. Seal gutter aperture 2 to 3 millimeters below CEJ with glass ionomer cement, and to help prevent internal root resorption. B. Sodium perborate, okay? Sodium perborate and superox 30%, which is 30% hydrogen peroxide, is not recommended. C. Sodium perborate and water ratio of 2 to 1 grams per ml is preferred. D. Sodium perborate and 3% hydrogen peroxide can be used in severe cases. E. All the above. Okay, so all the above for tooth bleaching is correct. These are the things you're supposed to do when you are doing a non-vital tooth bleaching. Okay, so our answer is E. All right. So some of the things you're supposed to know, make sure that for vital tooth bleaching, you have to, when you open up the cavity, okay, and you want to do internal bleaching, make sure that you seal, okay, got a picture. So this is non-vital, so you have done the root canal on this tooth already, okay? So you have to seal the gutta picture 2 to 3 millimeters below the CEJ with glass ionomer, okay? And cement. So you put the glass ionomer cement, and this helps to prevent internal root resorption. And you must take PA to make sure that you're in you have put adequate cement below the CEJ. If it's not below the CEJ and the cement ends up being above the CEJ, then your bleaching is not going to be uniform. All right. So for non-vital tooth bleaching, you can use, okay, sodium perborate and water ratio of 2 to 1 gram per ml. Make sure you know this, okay? Make sure you know it really well. All right, sodium perborate and water ratio. This is for non-vital tooth bleaching. Okay, And the use of sodium perborate and superox, 30% hydrogen peroxide, is not recommended. So make sure you know this slide very well. Okay? And the sodium perborate and 3% hydrogen peroxide, it can be used in severe cases. Okay? All right. Question 13. Regarding cutting instrument code, we discussed this in the first series about the 3-number code. Now this is a 4-number code. So regarding the cutting instrument code 1085-814, which of the following statement is correct, right? So 10 represents the width of blade in tenth of millimeters. B represents the primary cutting edge angle in centigrade, and C represents 40, okay, so 14 represents the blade length in millimeters, and 85 represents blade angle in centigrade. So D is wrong, okay? 85 is not the blade angle, all right? Because the blade angle is the last number. So if the blade angle is the last number, it means C is wrong, okay? Because 14 is supposed to be the blade angle. And 8 is wrong, so we have A. So the first, remember when we were discussing the first series, we say that the first number always, it doesn't matter whether it's a 3-number code or the 4-number code, the first number is the width of the blade in tenth of a millimeter, and the last number is the blade angle in centigrade. Okay, so our answer here is A. All right, so make sure you review. Let's review again. All right, I know we reviewed in the first series. Let's look at, so the three or four numbers. Okay, first number, so the for the 4-number code, the first number is the width of the blade or primary cutting edge in millimeters. Okay, and the second number of the 4-number code is the primary cutting edge angle in centigrade, and always exceeds 50. All right, and the third number, which is the second number of the 3-number code, is the blade length in millimeters, and the fourth number, the third number of the 3-number code, is the blade angle in centigrade, always 50 or less. Okay, so make sure you look at this, make sure you understand these numbers. As I mentioned in the first series, these are free questions you're supposed to answer correct. These are free points. Okay, so don't go in your national board exam without knowing these things. All right, so question 14. Which of the following is a characteristic of class 2 amalgam preparation? So you have to know amalgam preparations, okay? Because the classical preparation is an amalgam class 2 preparation. So you have to know it well, okay? So which of the following characteristic is a characteristic of class 2 amalgam preparation? A, internal line angles are at right angle. B, gingival wall has a rounded gingival axial line angle. C, occlusal isthmus width is half of intercuspal distance at maximum. D, or the above. Okay, so gingival wall has a rounded gingival axial line angle, and this is true. Remember that that's in the first series. That was the first question of the first series. Okay, so our answer here is B. All right, and let's see some of the properties about amalgam preparation. Okay, so amalgam preparation, the properties that should have. Okay, so the occlusal isthmus width should be 1/3 intercuspal width. Okay, at maximum, and the depth into the dentin is 0.5 millimeters. Make sure you understand that. Okay. Gingival wall has gingival axial line angle that is slightly rounded, and that allows for bulk of the amalgam. Otherwise, the amalgam is going to fracture because of internal stresses. Okay. Inclination of the walls with respect to occlusal surface is that the buccal and the lingual walls converge approximately parallel to the external surface. Okay, so the buccal and lingual walls are supposed to be convergent. All right, and the axiopulpal line angle is beveled or rounded. All right, internal line angles are also rounded to minimize stress on the amalgam, and the proximal retention form, you can add retentive grooves. Okay. All right. So make sure you know class 2 amalgam preparation, the properties or the characteristics that you're supposed to have. Question 15. Okay. So which of the following materials retard PVS, polyvinyl siloxane, okay, or vinyl polysiloxane, so PVS. So which of the following retard PVS? Okay, so A, sulfur, B, aluminum sulfate, C, ferrous sulfate, or D, all the above. Okay, so our answer here is all the above. Okay, so D. All these, sulfur, aluminum sulfate, ferric sulfate. Remember, the aluminum sulfate and ferric sulfate, they are found in retraction codes. Okay, so you have to know that these are going to retard the PVS. Okay, all right, so quick review. So things that retard PVS, we have sulfur. Okay, so materials that decrease or retard additional silicons, we have sulfur, which is found in latex gloves, the ferric and aluminum sulfate cords. Okay, and temperature also retards additional silicons. High temperature decreases working and setting time, and low temperature increases working and setting time. All right. So these are a few properties that you're supposed to know about the PVS additional silicons. Okay. All right. Now, question 16. Which of the following is correct statement about reverse S-curve? So remember, your class 2 amalgam preparation is supposed to have a reverse S-curve. Okay. So which of the following is correct? So it is formed from buccal of proximal box. So it's formed where the buccal of proximal box meets the buccal of occlusal prep. B, maintains triangular ridge of buccal cusp. D, maintains 90-degree curval surface margin, or D, or the above. So all of these are properties are correct regarding the reverse S-curve. It is formed where the buccal of the proximal box meets the buccal of the occlusal prep, and also it maintains the triangular ridge of the buccal cusp. Otherwise, if you just go straight without making the S-curve, you're going to go into to go into the buccal cusp, or compromise the integrity of the buccal cusp. Okay, So it also maintains 90-degree curved surface margin. So all these are correct. So D is our answer. All right. So 17. Which of the following statement is correct regarding spherical amalgam? So you're supposed to know the types of amalgams, okay? So spherical amalgam is easier to achieve tight proximal contact, or B, it has longer working time, or C, higher resistance to condensation, or D, higher initial contraction and micro leakage. Okay, so you're supposed to know. So our answer is D. Spherical amalgam has higher initial contraction and micro leakage. Okay. All right. So these are the properties of amalgam. Yes, so types of amalgam. So spherical amalgam requires less mercury for mixing. It has higher initial contraction and micro leakage. It has faster setting and shorter working time. However, the admix amalgam is easier to achieve tighter proximal contact and line angles. It sets slower. It has longer working time. It has less post-op sensitivity, and it has higher resistance to condensation. Okay, so you have to use more force to condense this amalgam. All right, and you have to know that the Valiant PhD XT extended is an admixture type of amalgam, which is slow set. Okay. So, question 18. Which of the following cements listed below has superior mechanical properties? So, as I mentioned in the first series, you have to know cement properties before you go in the exam. Okay. So, which one has the superior mechanical properties? The glass ionomer, zinc phosphate cement, zinc polycarboxylate, or all the above are correct. Okay. So, mechanical properties here is going to be A. Glass ionomer has superior mechanical properties compared to zinc phosphate and zinc polycarboxylate cement. Okay. And this is feedback on glass ionomer. So glass ionomer has a chemical bond, okay, to dentin and enamel. It has anticardiogenic effect due to fluoride release. It has a coefficient of thermal expansion, which is similar to that of the tooth. It has higher compressive strength and lower solubility. Also, the glass ionomer has low initial pH, which may lead to sensitivity. So you have to keep that in mind. It is sensitive to both contamination and desiccation. It has mechanical properties which are superior to both zinc phosphate and polycarboxylate. Okay. Question 19. Alginate. Okay, so if you are studying for this for the part 2, make sure you know the properties of alginate. All right. So alginate is poured in what type of stone? A, type 4 or 5 stone. B, type 2 or 3 stone. Type 3 or 4 stone, or type 1 or 2 stone. So our answer is A. Okay. Alginate is poured type 4 or 5 stone. All right. So make sure you know this. The alginate, okay. So the water powder ratio of alginate affects the setting or the gelation, but not the accuracy of the alginate. This is a key point. Make sure you understand that one. Number 2. So the reactor in alginate is calcium phosphate. That's the reactor. And make sure you know the formula for alginate also. That helps a lot. Alginate impressions are poured immediately or within 12 minutes to maintain accuracy. And alginate is poured with type 4 or 5 stone. All right. All right. 20. Which of the following statement is correct regarding hydrogen peroxide versus carbamide peroxide? So these are materials which are used for bleaching. Okay. So make sure you understand these. All right. So which of the following is correct? So half of hydrogen peroxide is released during the first 30 minutes, whereas 50% of carbon peroxide is released in 2 to 4 hours. 1/3 of hydrogen peroxide is released during the first 30 minutes, whereas 20% of carbon monoxide is released in 2 to 4 hours. Okay, so this C actually is part of B here, and where it says D is supposed to be C, so all the above are correct. So here our correct answer is A. Okay, A is the correct answer. And let's look at the properties, okay, about bleaching material. So HP here stands for hydrogen peroxide. Okay, so half of hydrogen peroxide is released during the first 30 minutes. This is true. This is okay. This is true. So that's why A was true. And CP here stands for carbamide peroxide. Okay, but carbamide peroxide releases 50%. All right, in 2 to 4 hours. So that's correct. Okay, and 10% of carbon peroxide equals. You're supposed to know this. 10% of carbon peroxide equals 3.3% of hydrogen peroxide and 3.7% of urea. And when you're using power bleaching, for power bleaching uses 15 to 40% hydrogen peroxide, and at home bleaching has less concentration, so it uses 10 to 22% carbon monoperoxide or 4 to 10% hydrogen peroxide. So if you are bleaching at home, you are most likely to use this, and if the power bleaching in office bleaching uses 15 to 40% hydrogen peroxide. Okay. All right. So coming up next is the Operative Dentistry Review Series number 3. So make sure you review number 1 if you haven't reviewed series number 1, and also subscribe. Click the bell. Make sure you click the bell, the notification, so that when the other videos in the series are added, you can receive the notifications. Okay. All right. Keep studying hard and good luck.